Hi, my name is Dr. Micheal Lloyd, DO, FACC, board certified cardiologist and interventional cardiologist. Today, we're in our cardiac catheterization laboratory, and this is where we perform our diagnostic procedures and interventional procedures. Typically, our top 5 procedures will be diagnostic cath, interventional cath, where we perform balloon angioplasty or stents. The stents look like a spring on a ballpoint pen and act like a little metal scaffold to keep the plaque tacked up against the artery wall. We perform pacemakers, defibrillators, and then specialized defibrillators for folks that have congestive heart failure. So typically when you present to Newman Regional Hospital with a complaint of chest pain or shortness of breath, you would go to our emergency department, where we have a very excellent and competent team of physicians and nurses that will take care of you initially. Typically then they would ask for Krista or myself to participate in your care, and we would see you in the emergency room and then make a determination on where you should be admitted, or if you come directly to the cath lab. Come directly to the cath lab. We also have a very experienced team of about a half a dozen individuals that will work along with me and perform your procedure. When your procedure is completed, you would typically go to the clinical decision unit, 3rd floor telemetry, or ICU, depending on what we did or didn't do during your procedure. And in each of those places, you'll encounter another half a dozen very competent nurses who will take care of you until the time of your discharge. After your procedure, you would follow up with us in the office, and usually a month. You'll be greeted very warmly and friendly by our receptionist, and then our very competent nurses who have many years of cardiovascular experience will bring you back into the office, take your vital signs, review your brief history, obtain an EKG, and then typically hand you off to Krista or myself. Krista and I will see you. We'll make a physical exam, and then we'll make an assessment of how you're tolerating your new medications. During the office visit, we typically like to engage the patient as a person, not as a disease process. We like to take into account the entirety of what they're going through in their life, family situations, other social situations that may be providing stressors in their life. We like to have the patient engaged and perform what we call shared clinical decision making, which will help us kind of guide the direction their therapy should take and make sure they have an active involvement, so they're more likely to adhere to the recommendations that we're making. During the office visit, I like to write notes to the patients on any changes we've made in medications or reminder notes about procedures. And then typically, as I'm explaining either the procedure that we've done or the procedure that's upcoming or their disease process, I'll hand draw them a picture of everything that's going on to help them better understand it. I do this every day, but for the patient, it's a once in a lifetime. So I try to make sure they have a very good understanding of their disease process or procedure before they leave the office.